Good morning, guys. Dr. Mindy Salvino here, board certified naturopathic doctor, registered holistic dental hygienist, and owner of the Pure Health Collective. I wanted to do a video on frequency therapy, Rife therapy. I have the largest practice in Oklahoma for Rife therapy. I have 9 or 10 units. It's a very busy therapy room day in and day out, but I want to talk a little bit about what exactly it does. So it is frequency therapy. If someone comes into me and let's say they have a tapeworm, there are very specific frequencies that I would program into my machine. I would hook them to the machine first of all, which consists of metal foot plates. They would put their bare feet on metal foot plates. We have little brass electrodes. I also have glass noble gas ones that I use depending on the person and the situation. I also have a PEMF mat that I can attach to my Rife machine for other situations, but I would hook them to the Rife machine, and if they have a tapeworm, for example, I would run 727 hertz frequency sound wave oscillating through their body. When they have the electrodes in their hands and their feet on the foot plates, their body creates a closed circuit, 4 points of a closed circuit. So I would run that specific sound wave oscillating through their body, and that sound wave is outside the vibrational threshold of a tapeworm. So when a tapeworm is exposed to this sound wave, it vibrates, it loses all of its structural integrity, it breaks into a bunch of little pieces, and then I use the ozone therapy to flush the remnants out of the lymphatic system, out of the body, to detox you of the debris that's left over when you kill a parasite or a bacteria or a mold. They release a die-off protein. So I use the ozone therapy in conjunction with that to flush the body out of the remnants of what the Rife machine has killed. It has taken me years to develop the protocols that I use for different issues. I have a ton of people with PANS, PANDAS, sensory processing disorders, strep bacteria, mold exposure, fungus exposure is huge in my practice. There's so many people that come in that have been really sick for a really long time. Usually it's from the conditions in their home or a rental that they're living in, and these people are very, very sick. Mold exposure tends to be cyclic, so they are sick for a few weeks, they feel better, then they get constantly sick again in a cycle. Rife therapy has been around since the early 40s. It is very effective, and it's just using sound waves to obliterate things that are unwanted in the body.